Hello, my name is Blake Bear. I am a current ICU nurse hoping to become a CRNA, and I wanted to film a quick presentation on my Mindmap. It's a note-taking system that I built using Obsidian. This is a shortened version of a longer video that I've made just for convenience sake, since there is obviously a lot to cover here. So this is built with a program called Obsidian. It's a text editing software, and the real special thing about Obsidian is that you can take these your text files and create links between the text files. And so what you're seeing in this graph is actually a bunch of text files. That's what all of these notes, these circles are. And then these lines between the nodes are just links between the nodes. And so I actually built this using my software engineering experience that I got in between my nursing experiences. And it's actually using a lot of software engineering principles. And so it's very flexible, but also very powerful. So the heart of this contraption is that it allows me to combine my real-world clinical experience with textbook studying or any other form of education that I might avail myself to. So I will show, so each of these different colors represent something different in the graph, a different kind of note. These orange ones here are conditions or diagnoses. Obviously, we'll make the quick disclaimer that this is a note-taking system. It's my personal notes. I'm not claiming to make this as like a professional library of knowledge. It's imperfect. It's growing. So that's my disclaimer. Continuing on then, with these orange nodes, acute kidney injury, heart failure, sepsis, some myocardial infarction. We also have different kinds of interventions that we might do. So maybe like MTP, ultrasonography, a gastric tube, enteral feeding, EGD, mechanical ventilation. Then we also have medications. So the red notes are any meds. We got digoxin, Levophed, labetalol, and obviously there's a bunch: propofol, famotidine, fentanyl. Goes on and on. After that, we've got pathophysiological concepts: acidosis, alkalosis, and then there's obviously a bunch of these: hypokalemia, hyperkalemia. These are basically just something that's gone wrong. We have pharmacological concepts, which can be maybe like the mechanism of a drug, an alpha-1 agonist or an antagonist. Could also be sort of the macro category, as I would call it, an antihypertensive. It's a vasodilator, that sort of thing. And also including hepatic clearance, so the different CYP enzymes that are relevant to a given drug. Then we get into the meat of this, so to speak, where it becomes really powerful. I have what I call mechanistic and cause-effect notes or nodes, and the mechanistic nodes are these green ones here, and essentially it's just a thing that happens, whether it's an increase and or a decrease. And so we could see like a decrease in left ventricular cardiac output. That's a mechanistic node. Then these cause-effect nodes are linked here, and they basically allow you to trace causality through the graph. So a decrease in left ventricular cardiac output that's the root cause of cardiogenic shock. We can also see here that a decrease in heart rate results in a decrease in left ventricular cardiac output. And so that is really the powerful condition, that's the powerful way that this graph actually functions, because you can trace all of these biological or physiological, pathophysiological loops, and even including medications. Like I have in here, an alpha-1 agonist causes an increase in alpha-1 stimulation, which causes vasoconstriction. And I've also got some of the G proteins modeled in here. Like, it's very, very flexible, very powerful. On top of that, I will show this quickly here. Each of these notes then, I can take notes inside the node itself. And so that gives this sort of depth into this system. And so I can take, here's my quick recall, just at a glance. Here's some harm pathways, the interventions we might do, medications, this sort of thing. I can also add my patients in here, which I think is probably one of the most powerful parts of this whole graph. So I can take these patients and I remove obviously all their PHI, but I can take a patient and link everything they were on and what was going on, and it gives me the clinical context of what this medication or this condition or this situation actually looked like in a real life patient. And so it's been really powerful so far, and I think as I continue to use it, it's only going to get better. So my plans for the future with this is to obviously continue using it as I continue ICU nursing. It's been a really helpful tool for studying. It gives me a clear direction, clearer pathway to study. And I'm planning to use it in CRNA school so that as I come across lectures and take notes and anything else, I can actually input them directly in the graph. And then whenever I'm studying, I can look back at all of my previous studying that I've done as an ICU nurse, as well as real life patients who have had this same situation. And I think it's going to be a very significant force multiplier for me in CRNA school. So if this interests you, I do have a slightly longer video that goes into some of the different notes and some of the different ways that I use this. So it's a little bit redundant, but hopefully this is interesting enough that that doesn't bother you too much. So thanks for watching, and take care.